This video addresses common questions you may have regarding cardiac rehabilitation. This video is for education and assistance. It is not medical advice. Any questions or opinions in this video, while referenced in the medical literature, should be addressed to your physician. For brevity's sake, we will use CR through this video to mean cardiac rehabilitation. At the end of the video, there will be a list of additional resources for your own reading or research.
You might be reading this from a hospital bed, or maybe you are at home, recovering. A doctor may have just told you that you had a heart event. This could be a heart attack, a new stent, or even heart surgery. It is a scary time. You probably have a lot of questions. What happens next? How can you get back to your life? Will you ever feel strong and confident again? These are normal feelings. But I want to tell you there is a clear, proven path forward. It is a path that has helped millions of people just like you. It is a program designed to make your heart stronger and your future brighter. This journey is called cardiac rehabilitation, or cardiac rehab for short. So what exactly is cardiac rehabilitation? Let's break it down into simple terms. Cardiac rehab is a medically supervised program designed to improve your cardiovascular health. It is prescribed by a doctor after you have had a heart attack, heart failure, angioplasty, or heart surgery. It is a structured plan that combines exercise education and counseling. The main goal is to help you regain your strength. It also helps you reduce your risk of having another heart problem in the future. The program is not a one-size-fits-all solution. Your cardiac rehab plan is personalized just for you. Before you start, the team will do a full medical evaluation. They will look at your health history and your current fitness level. Based on this, they create a safe and effective plan. This plan includes monitored exercise to help your heart and body get stronger. It also includes education about healthy living. You will learn about eating a heart-healthy diet, taking your medications correctly, and finding healthy ways to cope with stress. It's a complete package for a healthier you. Let's look at two different people who benefited from cardiac rehab. First, meet Robert. Robert is 68 years old and had a major heart attack. He needed emergency surgery to place 2 stents in his arteries. Before his heart attack, Robert was not very active and had type 2 diabetes. He was very scared after his surgery. He felt weak and worried that any physical activity would be dangerous. His doctor strongly recommended cardiac rehab. Robert was hesitant, but his family encouraged him to go. At cardiac rehab, the team started Robert on a very gentle exercise plan. He walked slowly on a treadmill for just a few minutes at a time. A nurse monitored his heart rate and blood pressure constantly. Slowly, over many weeks, Robert's confidence grew. He learned how to check his own blood sugar and make better food choices from the dietitian. After completing his 36 sessions, Robert was walking for 30 minutes without any problems. He lost weight and his diabetes was under better control. Now, let's meet Susan. Susan is 55. She went to her doctor for chest pain and learned she had a blocked artery. It was not a full heart attack, but she needed a planned procedure to place 1 stent. Susan was already fairly active and ate a healthy diet. She was considered a lower-risk patient. She wondered if she really needed cardiac rehab. She thought she could just continue her regular exercise at home. However, her doctor explained that even for her, a supervised program was the safest and most effective way to recover and prevent future issues. At her cardiac rehab sessions, the exercise physiologist helped her understand her new limits. They taught her how to build up her intensity safely. Susan found the support from other patients in her group to be incredibly helpful. For Susan, cardiac rehab was about fine-tuning her healthy lifestyle and gaining the peace of mind that she was doing everything right for her heart. When doctors recommend cardiac rehab, it is because the evidence is overwhelming. This is not a new or experimental idea. Decades of scientific research have proven that it works. The data shows that patients who complete a cardiac rehab program have a much better future. One of the most powerful statistics is this: participating in cardiac rehab can lower your risk of dying from a heart condition by up to 47%. Beyond just living longer, cardiac rehab helps you stay out of the hospital. Studies show that patients who go to cardiac rehab are about 25% less likely to be readmitted to the hospital in the year after their heart event. It means fewer scary trips to the emergency room, fewer stressful hospital stays, and lower medical bills. Cardiac rehab also significantly reduces your chance of having another heart attack. The combination of supervised exercise, a healthier diet, and proper medication management makes your heart and blood vessels healthier. It is also important to know that the more you go, the better it works. Someone who completes all 36 recommended sessions will have a much lower risk of death and hospitalization than someone who only attends a few. One of the biggest worries people have after a heart event is about exercise. Is it safe? Could it cause another problem? This is exactly why cardiac rehab is so important. It is not just a gym. It is a medical facility. Safety is the #1 priority. Every single session is supervised by a team of highly trained healthcare professionals. These are nurses and exercise physiologists who specialize in caring for heart patients. They are experts in understanding what your body is going through. Before you even begin your first exercise, the team does a thorough assessment. They check your medical history, your medications, and your current physical condition. They monitor your heart rate, your blood pressure, and your heart's rhythm using an ECG monitor. The staff is trained in advanced cardiac life support, and the facility is equipped with emergency medical supplies, including oxygen and defibrillators. The risk of having a serious complication during a rehab session is incredibly low, about 1 event for every 80,000 hours of patient exercise. The program is designed to build your confidence just as much as your physical strength. The team is there to guide you and reassure you. They teach you how to listen to your body and recognize the difference between normal exertion and a warning sign. This feeling of safety and confidence is a crucial part of your recovery. It allows you to focus on getting stronger, knowing that you are in the best possible hands. When you join a cardiac rehab program, you become part of a team. This team is a group of dedicated professionals all working together for your health. The leader is often a medical director, a cardiologist, or other physician who oversees the program. The people you will see at every session are the clinical staff. This includes cardiac nurses and exercise physiologists. Your team may also include other important experts. A registered dietitian can work with you to create a heart-healthy eating plan that you can actually stick with. A pharmacist might review your medications with you to make sure you understand what each one does and why it is important. Some programs also have a mental health professional, like a psychologist or social worker. They can help you cope with the stress, anxiety, or depression that can sometimes follow a major heart event. So, what does a typical session look like? It usually lasts about an hour. When you arrive, the first thing you will do is check in with the nursing staff. They will take your blood pressure and ask you how you are feeling. They will attach small pads called electrodes to your chest. These are connected to a small transmitter that sends your heart's electrical activity to a central monitoring station. After your check-in, you will start with a gentle warm-up. This gets your muscles ready for activity. Then, you will move on to the main part of your session, which is usually about 20 to 40 minutes of aerobic exercise. You might use a treadmill, a stationary bike, an elliptical trainer, or an arm ergometer. After the aerobic portion, you will do a cool down to let your heart rate come down slowly. Finally, you might do some light strength training or stretching exercises. Every step is guided and monitored to ensure you are safe and getting the most benefit. A common question patients have is, how will I pay for this? The good news is that cardiac rehab is considered an essential medical service. Because it is proven to save lives and reduce healthcare costs in the long run, most insurance plans cover it. Medicare in particular has very good coverage for cardiac rehabilitation. It is recognized as a critical part of recovery from a heart condition. Medicare Part B covers cardiac rehab for patients with a number of common heart conditions. If you have had a heart attack in the last 12 months, you are likely covered. Under traditional Medicare, you can expect to be covered for up to 36 sessions. These sessions are usually scheduled 2 or 3 times a week for about 12 to 18 weeks. For each session, Medicare Part B will pay 80% of the Medicare-approved amount. You would be responsible for the remaining 20% copayment, and your Part B deductible applies. The best thing to do is call the member services number on the back of your insurance card. You can also ask the staff at the cardiac rehab facility for help. They are very experienced in dealing with insurance companies and can often help you understand your benefits and any out-of-pocket costs you might have. They want to make it as easy as possible for you to get started. Once your doctor recommends cardiac rehab, the next step is to find a program. You can find accredited programs through organizations like the American Association of Cardiovascular and Pulmonary Rehabilitation, or AACVPR. Their website has a directory that lets you search for certified programs in your area. You might wonder if you can just do this on your own. After all, you can buy a treadmill and look up healthy recipes online. While doing something is better than doing nothing, trying to replicate cardiac rehab at home is not the same. It can even be risky. The single most important benefit of a formal program is the medical supervision. The trained staff can spot a potential problem with your heart rhythm or blood pressure before you would even feel it. Another key benefit of a supervised program is the structure and support. It is easy to lose motivation when you are exercising alone at home. Going to scheduled appointments creates accountability. You are part of a group, and you have a team of professionals expecting you. Finally, a formal program offers comprehensive education that goes far beyond just exercise. You have direct access to dietitians, nurses, and other experts who can answer your specific questions. Your recovery from a heart event is a journey, not a single destination. The road ahead may seem uncertain, but cardiac rehab is your roadmap to a healthier, more vibrant life. The decision to participate is one of the most important you will make. Do not delay. The sooner you begin after your heart event, the better your results will be. Talk to your doctor today. Ask for a referral to a cardiac rehab program. Take that first, crucial step on your path to recovery. Remember that you are not on this path alone. Your cardiac rehab team is there to be your partner in health. You will also be surrounded by other patients who understand exactly what you are going through. This shared experience creates a powerful sense of community and encouragement. Cardiac rehab is about more than just surviving. It is about thriving. It is about having the energy to play with your grandchildren, the confidence to travel, and the peace of mind to enjoy each day without fear. You have the power to build a stronger heart and a stronger future. Embrace this opportunity. Make the call. Start your journey today and look forward to a longer, healthier, and more joyful life.